Thursday, January the 26th, 2021. Joining us today is Mayor John Tory and Toronto's Medical Officer of Health, Dr. Eileen de Villa. Mayor Tory.
Well, good afternoon, and thank you, Brad. Today is International Holocaust Remembrance Day, a day to honor and commemorate the lives lost to the Holocaust and to remember those who are alive with us today who bear those scars from that tragic time in our history. Although the Holocaust seems like a story from the past, today we are reminded of the continued senseless discrimination and violence towards Jewish people in our city and around the world. We're reminded of the work that lies ahead in eliminating anti-Semitism, as we're trying to do. Jewish people continue to face stereotyping, discrimination, and violence. Every day, and today in particular, we stand up against that anti-Semitism and evil that led to the Holocaust and pledge to work hard together so that something like this never happens again. This day is important to remember the victims and to make sure that the world never forgets the Holocaust. And it is a day on which we remind ourselves that hatred and discrimination against any group or faith have no place in our city, and that it is our job collectively to act in such a way as to make that foundational value a reality every single day, not just one day each year. Tomorrow is Bell Let's Talk Day, an initiative that has been going on for 11 years across Canada. Every year, Canadians come together with a united effort to raise awareness around mental health and funding. The day initiated by Bell, which itself makes significant financial contributions to mental health at the same time. So that you can help encourage that financial contribution to be bigger by participating tomorrow through texting, calling, tweeting, posting, and watching videos to help raise even more money for mental health programs and awareness. And right now, there is no better time to support mental health initiatives. There's no doubt that every single resident in our city has been impacted by COVID-19, and that in turn means our mental health and well-being, among other impacts the pandemic has had. I can speak for myself when I say that COVID-19 has affected all facets of my life, professional and personal. I miss my family, my kids, my grandkids. I miss seeing people. I miss going to events and hearing stories from people. It's an important part of my life and an important part of my job. I miss a lot of things, and I know that I'm not alone. I miss how things used to be and how they can be again. And it's okay to feel these things and not to be okay. What isn't okay is feeling alone and isolated and feeling that you are not supported. There is nowhere to turn for support during these difficult times. I am surrounded by a friends and family support system. So for me, pandemic fatigue doesn't become anything worse. But I know that many other people don't have that same system in place, and we need to be there to help them. That is why Bell Let's Talk Day and the programs we offer through the city are so vital to the well-being of our residents, the overall well-being of our residents. Let's use Bell Let's Talk Day as a catalyst to reach out to loved ones and to friends and to co-workers and neighbors and people we think might be alone and might be suffering some ill effects from the pandemic. As a city, we know that we need to do our part as a city government to support residents who need to feel that support in trying times. I want to remind residents of the help that is available to them through our pandemic mental health support strategy if they find themselves struggling. In partnership with 13 key mental health service providers, the city is able to offer free support services to people who need them. From April 27th to January the 9th, almost 110,500 Torontonians have either called, texted, or sent an online message for support and trying to take advantage of these services. Almost 100,200 people received direct mental health support, and more than 10,300 people were referred directly to mental health partners for additional support. So it shows you the breadth of the need here that has existed during the pandemic, some of which, of course, existed before that. Our mental health support partners report that calls have become increasingly more urgent, challenging, and complex. Frontline staff are reporting high levels of burnout. The data from partners demonstrates a rise in anxiety about COVID-19 as case counts increase and inquiries regarding the vaccine also increase. Since January 1st, crisis intervention contacts at 211, which is the number that you would call to access these services, intervention contacts at 211 are up 61% from the same time last year. But while that number is glaring, it is also a reminder that it is okay not to be okay, that you are not the only one experiencing difficulties and mental health issues right now, and that there is help available should you need it, and that you should reach out and seek out that help. Residents are reminded through the mental health support strategy, you can access free mental health support from the safety and privacy of your own home by calling 211. This free service is available 24 hours a day, 7 days a week, and they're available the services are for children and youth, seniors, frontline workers, and those with intersectional identities such as Indigenous, Black, persons with disabilities, and LGBTQ2S Torontonians. Specific mental health resources have also been mobilized for frontline workers, and frontline workers with minimal or no mental health coverage are encouraged to call 211 and seek out this support if they need it. I encourage anyone who feels lonely or isolated or unduly anxious or depressed, or who knows somebody who is struggling during this pandemic, to reach out for help. It is free, it is safe, it is easily available, and it is available to anyone who needs it. I want to thank all of our partners and the community agencies that have made this possible. We can't do it alone, and we are proud to work with such strong partners who themselves are so experienced and so committed at providing help for people who need it. And I want to say thank you as well to the frontline people who make the connections and who offer a helping hand to those who reach out for that help. You are also heroes in the list of heroes we've talked about over the course of this pandemic, and we appreciate very much the help you're giving, which itself helps to save lives. The City of Toronto was one of the first municipalities to move forward with mandatory mask rules in businesses, on transit, and in shared spaces in private residential buildings. Earlier this month, I asked staff to drill down into the complaints that we had received about masks and face coverings not being worn in apartments and condos. And that was so that we could identify any frequent addresses that we were receiving reports about, and to follow up with building owners who are the ones that are responsible for putting these policies in place in their buildings. An analysis of the 311 data, where we get the complaints by and large, revealed that 263 locations have received 3 or more complaints relative to people not wearing a mask. Our Rent Safe TO team will be issuing education letters to the landlords and property managers for each of these locations on the requirements under the mask bylaw, reminding them of those requirements and asking them to take action to do a better job. A further breakdown revealed 12 locations with more than 10 complaints each. Our Rent Safe TO team will follow up directly and in person on these locations with the landlords and property managers for each of these 12 locations, requesting to see their masking policy and looking to see if the signage is in place as we require. We will also make sure that the signage that we provided as a city from the beginning is placarded and located throughout the building, and we will conduct a follow-up inspection on those places that have been the subject of these multiple complaints. I want to reiterate that the bylaw approved by the City Council and recommended by the Medical Officer of Health and our city legal staff requires building owners or operators to have a policy to ensure masks or face coverings are worn by individuals in the enclosed common spaces, such as lobbies, elevators, and laundry rooms, and that they are to post corresponding signage telling people of those requirements. Finally, a message for pet owners. I know many dog owners were relieved when the province clarified that dog walking services are permitted during the current lockdown. Our city lawyers have been speaking to the province about other related businesses such as dog grooming and dog daycare. The matter is still in the hands of the lawyers, and I know that might cause people not to have any hope, and I say that as a lawyer. But I just wanted people to know that we are working on it. We are having the lawyers talk to each other, trying to provide this kind of clarification that people have the right to have in light of the various issues, including dog health and safety issues that are arising out of this. And I hope we will have an outcome from those discussions to report on very soon. I would now like to pass it to Dr. de Villa, who will provide today's report.
Thank you, Mayor Tory, and good afternoon. Today, I am reporting 502 cases of COVID-19. There were 41 admissions to hospital in the last day, bringing total hospitalizations to 520, and 114 people are in the ICU. Sadly, I'm reporting 11 more deaths today. 502 new cases may seem relatively low at first glance, but testing levels have been lower in the last few days, and when completed tests are lower, usually confirmed case counts are lower as well. I also want to stress that 502 confirmed cases is nothing to celebrate. Not many weeks ago, we would have undoubtedly considered 500 confirmed cases to be grim news. It still is. There is no guarantee of how the illness will progress in the people who make up these cases. My hope, all our hopes, is that they come through it with a minimum of discomfort and make a solid recovery without lingering after effects. Medically, we are in an uncertain phase of the pandemic. The emergence of coronavirus variants is one feature of this uncertainty. The latest figures I have indicate that there are 14 cases of the UK variant B117 in Toronto. Tracking the variant is the responsibility of Public Health Ontario, and they will continue to provide updates on variants, including confirmed cases. A point prevalence study on variants of concern is being done, looking at all positive COVID-19 samples reported on January the 20th. The results, which are due from our colleagues at Public Health Ontario in a couple of weeks, will give valuable information about the status of variants in the province. I've often said that there is so much we don't know about COVID-19. We're at one of those points now, and as new variants with new risks surface and the medical and scientific communities move to understand them. On the positive side, remember that the medical and scientific communities worked wonders in record time to produce the vaccines, which will help us out of this pandemic. This is a committed community, determined to resolve this health crisis. And it's worth remembering that sometimes new variants emerge and then disappear. Sometimes they persist. Variants may increase infectiousness, the severity of illness, and the frequency of death, or they may reduce these. Because COVID-19 is new, we are all learning, and learning takes time. I have confidence in the drive of the medical and scientific communities to gain knowledge quickly and find solutions. That said, it is important for the time being that all of us act as if the variants are spreading. The steps for self-protection, staying home, keeping apart, maintaining at least 6 feet or 2 meters of distance when you can't, wearing your mask and washing your hands. These remain critical recommendations to follow. This is because, simple and familiar as they are, these steps really do work. We know that older people are at greatest risk from COVID-19. Their vulnerability is one of the reasons we urge everyone to keep apart so much. At present, Toronto Public Health is investigating 96 outbreaks at long-term care and retirement homes in Toronto. 52 are active with documented transmission within the home. 44 are suspected. Toronto Public Health provides infection prevention and control and outbreak management advice and support to these facilities. We work with these facilities in a number of ways to control the outbreak and virus spread in these settings. We work with these homes in identifying where an outbreak is occurring, and we support homes to undertake specific actions, such as limiting access to parts of the facilities when an outbreak is contained in specific areas. The goal is to prevent virus spread and separate residents who are not infected with COVID-19 from those who are. There are very specific requirements that take effect during outbreaks, particularly governing facility activities, dining, and the admission of visitors. General visitors are not allowed access during a confirmed outbreak. Essential visitors are admitted for the purposes of performing essential supports, like food delivery, inspection, maintenance, healthcare services, or to see a resident who is extremely ill or receiving palliative care. Requirements are also in place for essential caregivers who must comply with testing requirements, personal protective equipment requirements, and infection prevention and control protocols. All this work is done in accordance with provincial guidelines and directives. The province is firmly behind the delivery of vaccines to the residents of long-term care and retirement homes. These residents are the highest priority vaccine recipients. In Toronto, COVID-19 vaccination in long-term care and retirement homes is a cooperative venture that currently involves Toronto Public Health, our hospital partners, and the long-term care and retirement homes themselves. The round of first visits for COVID-19 vaccination was completed on January 15th, and vaccination teams are ready to begin delivering second doses of the Moderna vaccine in these settings starting tomorrow. To begin this final phase of vaccination for long-term care and retirement home residents in Toronto is truly exciting. I hope this brings a feeling of accomplishment and a sense of optimism for all of us. With that, I'll turn it back to Brad for questions.
Thank you, Dr. de Villa. Before we go to questions, we have a number of staff on the line. If you have specific questions, including Chief Pegg. And for reporters, please unmute yourself before asking your question. We'll go first to Magda Galasalapra from CBC News. Magda, go ahead, please.
Good afternoon. Dr. de Villa, you said we should act as if the variants are spreading. And given the current situation with the UK variant, there are some experts that are saying restricting travel between jurisdictions may be needed to prevent community spread. So where do you stand on that?
Well, I think that's certainly something worth considering, and again, it will all depend on what we discover through the studies. If there is active community spread, then clearly the focus will need to be on that which we can do right now. And what we understand of the variants is that just like the previous virus strains that were circulating here, distance, distance, and distance continues to be the mainstay of self-protection measures. Of course, we still have to wash our hands, and if we can't maintain distance, to wear our masks as much as possible and to make sure that we're staying home when we're sick, these are still all very important elements. But I think that the guidance in respect of what we do really depends on what the diagnosis is, to what extent we can expect that variants of concern are circulating, how much is happening in our community, and that does come down to what each and every one of us can do in order to restrict our interactions with others.
And as a follow-up question, this is from a colleague of mine. At the start of the week, we had 8 outbreaks and 59 cases at city-run shelters. So what measures is TPH taking to protect shelter residents and workers?
Well, I can, you'll probably get better details from my colleagues at Shelter Support and Housing Administration, but let me start off with this. We work in partnership with our colleagues in shelters and make sure that they have the same kinds of advice and support that I was speaking of in respect of long-term care and retirement homes. There are a number of infection prevention and control measures that can be taken within the context of those settings. We provide advice to our shelter partners, around their questions that have to do with infection prevention and control, and we certainly support them in the context of outbreaks. But is Marianne on the line?
Yes, she is. Marianne, if you could add to that, please.
Yes, good afternoon, and thank you for the question. We've been implementing a comprehensive IPAC measures since the beginning of the pandemic, holding regular and ongoing webinars right across the homelessness sector to make sure that everyone is aware of the most recent advice from public health and is able to ask their questions. But we've also been reinforcing the message because of the variant and because we want to make sure as much as possible that we maintain the lowest infection rates that we can in the shelter system. We've been having our quality assurance team conduct ongoing site visits to confirm compliance with IPAC measures. Staff and clients are required to wear masks when they are inside the shelters and maintaining 2 meters of physical distancing. We're distributing more than 100,000 pieces of PPE to the homelessness sector every week to be used by staff. We're also holding daily meetings with TPH and coordinating on-site testing for clients to make sure that we are aware and on top of any infection as soon as it happens. We also continue to offer our isolation site and working very closely with the inner city health associates to make sure that we are providing access to isolation and recovery for anybody who tests positive for those. But we remain very vigilant and working in close step with Toronto Public Health.
Thank you very much, Marianne. We'll go next to Ashley Legasic from News Talk 1010. Ashley, go ahead, please.
Thanks very much, and thank you everyone for taking my questions. Dr. de Villa, this first one is for you. Several European countries have mandated medical grade masks instead of cloth masks in indoor places. They say the cloth masks are not as effective in stopping the new variants that are emerging. So Dr. de Villa, are you going to be making a similar recommendation? Would you like to see that mandate put in place here?
So Ashley, as I mentioned in my remarks, there is this constant learning that is ongoing with respect to COVID-19. And that has been the case throughout the pandemic, and I expect that that will continue to be the case on the go forward. I would say this, when we look at those, what is happening in other jurisdictions, that certainly forms part of our knowledge base and is used to inform our understanding and inform our actions here. When it comes to that kind of scientific information, what is the best protective equipment, including masks to use for the general sort of public and in general circumstances, we do rely quite heavily on our partners at the federal level and at the provincial level. We have Public Health Ontario as the agency which provides scientific advice for the public health field in the province. So I'm sure that this is the kind of thing that they are actively looking at. And we'll expect that there will be ongoing discussions and regular evaluation as to what is the best form of protection for the general public given our current circumstances with COVID-19 and our current understanding of new variants and their presence in the community. That being said, still, measures for self-protection. We cannot emphasize enough how important it is for people to limit their outings as much as possible to that which is truly essential. This is the best way you achieve that goal of distance, distance, and more distance. Again, this is still such a fundamental point for the public. And as the science changes and evolves in respect of what are the best personal protective equipment pieces or masks to use, we'll keep you informed on that.
Thank you. And my next question will be for both Mayor Tory and Chief Pegg. I understand the city is going to start barring non-Toronto residents from outdoor skating starting next month. How is that going to be enforced? And can you comment on how things have changed on the enforcement front for people skating outside of permitted hours?
I will ask Chief Pegg to comment on the latter. because I know we mentioned earlier in the week it continues to be an issue to some extent. I'll just say, we had a number of complaints from people who were having some trouble making a reservation, and they felt it was unfair that people from living outside the City of Toronto should have the opportunity to make those skating reservations. It was only, I think, just under 3% of the total reservations that were made, and it is still possible for somebody from outside the city to use one of the walk-on spaces if there is a space available and no one else is using it. But I think it is a fair requirement to say that the limited numbers of rinks, especially when we've limited the time people can use those rinks to 25 minutes and limited the number of skaters, that, certainly I'll say first preference and exclusive preference on the reservation system should go to residents of the city, and so that's what we're doing.
So what I'll do is I'll ask Janie Romoff, who's the General Manager of Parks, Forest and Recreation, to comment, and then Carlton Grant from Municipal Licensing and Standards on the enforcement piece. Janie, do you have anything to add?
Thanks, Brad. No, not just, the Mayor, Mr. Mayor, you got most of it in your comments. I would just say that we do have a Toronto Residents First registration policy when we're running our regular programs, where we only open up registration to Toronto residents for the first 10 days, and then outside of Toronto residents can only register once there's space available. So we're using the same principles in the skating reservation system now. They can only participate if there, in fact, is space available and on a non-reserved basis.
Thank you, Janie. Carlton, do you have anything you wanted to add on the enforcement side?
Yeah, thanks, Brad. And yeah, we're working closely with Janie as well as the police and corporate security on this issue. It's happening early in the morning and it's happening after hours. What's important to note is that a lot of these people that are partaking in the skating are youth. So we're not in, we don't have the ability to ticket people under 18, but it's really important for people to follow the rules, be aware of what those rules are, and to treat our staff, park staff, with respect when you are asked to leave the rink. There's a lot of unacceptable behavior out there that needs to be.
I think you cut out there, Carlton, but thank you. I think we got the gist of that. Appreciate that. We'll go next to Tina Yazdani from City News. Tina, go ahead, please.
Hi there. Thanks for taking my questions. I wanted to ask about the situation at Beverly School. The school serves special needs children, so it does remain open for in-person learning, and a number of support staff are refusing to work due to safety concerns. There are growing calls to send rapid tests to the school and test staff before an outbreak occurs. The province tells me it is up to the local public health unit to decide where rapid tests are sent. So I'm just wondering why rapid tests aren't being sent to more schools as a preventative measure as opposed to after an outbreak has already been declared.
So thank you, Tina, for your question. First and foremost, I just want to delineate that issues that relate to occupational health and safety, as related as they might be to our work in public health, they do fall to occupational health expertise and to our colleagues at the Ministry of Labour overall. That's the group that is most responsible for issues related to occupational health and safety. When it comes to the issue of rapid testing, of course, testing is actually a provincial purview, but we have been working with a variety of partners, clinical partners in particular, as they engage in testing most actively. So we've been engaged with those partners to try out these various rapid testing methodologies over the course of the fall or towards the end of the fall. So there are ongoing conversations that are happening right now between the team at Toronto Public Health, and this engages our provincial partners and clinical partners who are the administrators of the test, to try to appreciate and understand where best to deploy these tests in the city, and how we might use them to help support the ultimate goal of providing the safest environment possible in schools for our students and for the staff that work there. So this is ongoing, and the discussions are continuing, and we look forward to actually having new news to provide and to implementing the best available supports that we can to create those safe environments in schools.
So I guess just to follow up on that, are the tests being saved for anything specific at this time? And do you think that Toronto Public Health is receiving enough tests from the province?
So Tina, with respect to the supply of tests, I'll have to go back to my team to find out exactly what our current state is. But, you know, my sense is that when we have made requests, reasonable requests, and provided a good rationale, that we have experienced a good partnership in respect of our school boards, with our clinical partners, and with all those engaged in those discussions, because there is really an interest in ensuring that schools are as safe as they possibly can be for students and for staff.
Okay, thank you. We'll go next to Morgan Campbell from Global News. Morgan, go ahead.
Hi there. Thanks for taking my question, guys. I just wanted to ask, how often are we testing for the variant? And should we be testing more? I know that the Minister of Health had mentioned something along the lines of 1,500 tests per week. Is the city doing anything in excess of that?
So Morgan, when it comes to testing, that is something that falls to the responsibility of the public health laboratory, which is under provincial purview. What I can say, based on, you know, conversations that we've had with our provincial lab counterparts, is that we know that they're doing this point prevalence study to take a look at all the positive COVID-19 tests that were picked up on January the 20th, and testing all of those for variants to try to understand how significant might the spread of variants of concern be? How much are we seeing of variants of concern here in the province at this point in time? But they do have particular criteria that they've put in place and that have been disseminated to public health partners and to those who are actually providing the testing, so that there are particular tests and circumstances that warrant screening for variants of concern. Again, an evolving process. We're learning all the time about these variants of concern. So while this is the process for today, I expect that as we learn more and more, that process may change over time.
Did you have a follow-up, Morgan? Morgan, are you there?
Sorry, can you hear me?
Yes, go ahead, please.
Oh, sorry. How should people be treating this variant? I heard one doctor say that everyone should be treating this as if it is, you know, right next to you in the community. What kind of advice, Dr. de Villa, do you have for people who may be worried about this variant?
So my advice has been consistent. My advice today is what I have provided, you know, over the past several weeks now. The best thing that we can all do to limit the spread of COVID-19, and this is especially true, you know, as we are starting to deal with this concern of variants in our community, is to continue to really be very vigilant around the measures for self-protection. So, you know, as challenging as it is, and as frustrating as it is, you know, the mayor made some comments in his remarks today about how difficult it is to not be in close contact with our friends and family beyond those with whom we live. But as difficult as that is, restricting our activity to the greatest extent possible, not coming into close contact with people outside of those with whom we live to the greatest extent possible, distance, distance, distance. And when you can't maintain that distance, when you have to be out for essential purposes, wear a mask as much as possible, wash your hands. All those measures for self-protection are the best thing that we can do in terms of protecting ourselves and protecting those around us. And yes, that includes, given our concerns around these new variants in our community.
Okay, thank you. We'll go next to Denise Peglinawan from the Canadian Press. Denise, go ahead.
Thank you, Brad. My colleague wants to ask if Toronto Public Health is doing any targeted testing in high-risk settings to find asymptomatic cases of variants of concern.
Again, sorry, Denise, you were asking about what efforts we're undertaking in terms of testing. So, there are particular circumstances, and we offer advice and provide testing in concert with testing partners in a wide variety of settings. So for starters, there are pop-up testing locations in areas of the community throughout our city where we know that there is increased activity of COVID-19. These settings and the testing is actually provided by our clinical partners. There are also certain protocols around testing, for example, within long-term care homes and retirement homes, where we know that there are, where the residents are particularly vulnerable to COVID-19. These are the kinds of efforts that are underway within our community to try to identify cases as quickly as possible and to reduce the spread of COVID-19 or any other variants of concern. But I will bring us back again to those self-protection measures. The things that each and every one of us can do to reduce this spread is still to practice those self-protection measures that we have heard about so many times over the course of the past several months. Maintaining your distance, wearing your mask when you can't, washing your hands as often as possible, and certainly avoiding other people and seeking testing as soon as possible when you develop symptoms that are of illness or that are consistent with COVID-19 infection.
And those testing that you mentioned, that includes testing for the variant? Because I know testing for a strain is separate from just testing to see if it's positive.
Sure. So the thing, as I mentioned earlier, is that testing, remember, is under provincial purview. So making determinations as to which circumstances are the ones in which samples will be screened and subsequently tested for variants of concern is something that is directed by the provincial public health laboratory. So there are particular circumstances where that kind of screening and testing for variants of concern is recommended, and that's done on the direction and the advice of the public health laboratory at the province.
Thank you very much. Final question is to Francine Copen from the Toronto Star. Francine, go ahead, please.
Oh, hi, good afternoon. My question is about reopening. I understand that certainly politicians are under a lot of pressure to reopen as much as possible, as early as possible. Have we reached a point where we can start talking about that yet, or still we're too far away? And if both of you could answer.
Yeah, I'll give you the answer from the elected representative perspective, which is the non-medical perspective, which is that I believe the time has come to start to talk about it, only so that we can have a proper, thoughtful plan that is both respectful of the needs of people and businesses and students, for example, but also very respectful of the fact that when we do come to reopen, one assumes we'll have made sufficient progress against the virus that we can't afford to backslide. And so I think the time has come. I was asked this yesterday to begin those discussions in earnest in a very practical way and develop the kind of program that we had in the spring, where it didn't happen all in one day, as probably it shouldn't and won't, but rather happened on some kind of basis that was consistent with public health, but also consistent with the realities faced by students and businesses and people.
So Francine, I would echo the mayor's comments that conversation actually is warranted. The earlier the conversation begins, the more cogent, I think, and the more thoughtful the planning can be. And we know from our experience in the past that it does require quite a bit of conversation and a great deal of thought to do something like reopening, to undertake the process and act of reopening in a mindful and thoughtful manner that respects the science and what we understand of disease and its spread in our community. I would suggest, though, that the actions, now is not the time for action beyond really encouraging people as much as possible to continue on with self-protection measures. You know, conversation around what reopening looks like is one thing, and I think that as I've talked about already, our knowledge is constantly evolving. We must constantly have this conversation with that knowledge that is getting upgraded on a regular basis. It's, you know, fascinating to me, given that we're dealing with a new virus, how rapid the learning is and how much knowledge exchange is happening at the global level. You know, that's what's brought us vaccines so quickly. And my sense is that it's also what's needed in order for us to find rational and cogent solutions as we emerge from the pandemic and as we, start to approach life that was a little bit more like what we were used to before. But for the time being, there is still quite a bit of COVID-19 activity in our community. We should be concerned around the presence of variants of concern. So at this point in time, we must still be incredibly vigilant around deploying and using those self-protection measures as vigilantly as we can, and to be very disciplined about that so as to limit the spread of COVID-19 in our community.
And my follow-up question is for Dr. de Villa. How concerned are you about the UK variant? Boris Johnson has said it's not just more contagious, but there's also evidence that it's more lethal as well, that there's a higher death rate associated with it. How concerned are you about this variant getting a hold here in the city?
Well, I think like most other public health practitioners, I'm very concerned about this. We have seen the impact of these new variants of concern in other jurisdictions. Locally, we have seen the impact, or nearby in the Greater Toronto and Hamilton area, we've seen the impact and the quick impact it has had on a particular long-term care home. So this is exactly the kind of thing that I think we need to be very, very concerned about. That's why I continue to emphasize the importance of those self-protection measures, that even in the face of case counts which are better today than they have been, and in some improving indicators around COVID-19 in our community, variants of concern, if they take hold and are as transmissible as we believe they might be, then I think we need to be extremely concerned and make sure that we are doing everything we can to really practice self-protection measures, to really keep our distance from others as much as possible, to reduce our outings as much as we can to that which is most essential, so that we can reduce the spread of COVID-19, including the spread of variants of concern.
All right, thank you very much for joining us. That concludes today's briefing. Our next scheduled briefing is next Monday, February the 1st at 2 p.m. Stay well.